Good afternoon, everyone. My name is Christy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Good afternoon, everyone. I wish I had better news today, but unfortunately, our case numbers continue to climb. Dr. Strang warned us of this earlier in the week. Now we have to face our new reality. COVID is making a comeback in parts of our province. We are reporting 10 new cases today. 9 are in the central zone and 1 is in the eastern zone. 5 of these cases are the result of close contacts, 2 are travel related, and 3 are under investigation. All are in self-isolation. Dr. Strang will have more details about the cases under investigation and his concerns around what appears to be a cluster in the greater Halifax area. It's those cases that are also causing me great concern. They crept up quickly and we continue to get a steady climb. So after much discussion with Dr. Strang, we are announcing new restrictions for Halifax Regional Municipality to Porters Lake, Elmsdale, Lance, to Mount Uniac in Hants County, and Hubbard's in Lunenburg County. For further clarification, please check the map on the website. Dr. Strang will have much of the detail regarding the restrictions, but I want to highlight some of what we are doing. Effective at 8 a.m. tomorrow morning, restaurants and licensed establishments in the affected areas will close 1 hour earlier. That means service, food, and alcohol will stop at 9 p.m. and doors close by 10 p.m. This is not to punish our restaurants. Restaurateurs have been leaders in our community and following all the protocols. But it is because of the gatherings and the timing that we have taken this step. This is not permanent, but at least for the next month. We want to thank the restaurants for cooperating and for your patience. We know how much you have sacrificed. And we want to thank Irving for taking immediate action in temporarily suspending operations as it further investigates potential spread. In fact, Irving is doing what Nova Scotia businesses do. It's stepping up for the collective public good. The close contacts of the individual are being tested, and Irving is embarking on a plan to test all of its employees at the shipyard. I want to mention the long-term care facility restrictions as well. Residents in long-term care homes can only have visits from their designated caregivers and only leave for medical appointments or for a drive. And one other measure. Nova Scotians are being asked to avoid all non-essential travel within the province, and especially to and from the restricted areas. In terms of other restrictions, Dr. Strang will have more information on sports and arts and culture events. Thank you. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. Before I start, I just want to recognize, I want to thank the St. Michael's Polish Benefit Society and the St. Mary's Polish Parish in Whitney Pier, and Miss Juliette McLeod, who sent me this very nice Cape Breton Polish tartan tie. I never knew something existed, but so thank you very much for that. As the Premier said, I am very concerned, and my concern is in 3 key areas. Our case numbers, especially in the Halifax area, are suddenly rising. We are seeing a number of recent cases where no infection source can be found. And in many of our cases, the broad list of contacts tells us that people are continuing to socialize and act as if we were not in a pandemic. The sudden increase in cases in the last 2 days has been seen throughout Halifax. We have cases in an unknown with an unknown source in Dartmouth, Spryfield, Bedford, Peninsula Halifax, Sackville, and Beaverbank. And again, the troubling aspect is that we're seeing consistently that people are socializing frequently and in multiple social groups in a given week. Too many people are not following the public health measures or following them only to the letter. We all need to take all the public health measures seriously, even if we don't feel personally at risk. We may not ourselves have a significant risk of severe COVID, but we all of us, if we're not careful, can pass it on to somebody who is at much higher risk. By being less than careful in our what the choices we make, we put people in our families, our communities, essential workers and healthcare workers in our communities at risk. So for the second time in 3 months, we have to activate what we're calling a circuit breaker in HRM. As the Premier said, we had hoped we would not be back in this situation, but a return to these type of restrictions are necessary. I fully appreciate how disruptive they are to families, to individuals, to businesses. However, COVID-19 is a social virus, so we need to focus our restrictions to limit social activities. What this does is allows us, while limiting the number of restrictions that we have, but putting those in place where necessary, it allows us to maintain our core priorities, which we have throughout the pandemic, which is protecting our most vulnerable, like senior citizens in long-term care facilities, keeping our schools and our post-secondary institutions safe and open, and allowing people to have safe social and recreational activities that can support their physical and mental health. We're trying to strike a balance, and we hope that people will listen and understand and lean in and make the necessary adjustments and the choices for themselves, for their families, and their communities. One of the reasons we've had an enviable record of low case numbers in Nova Scotia is our willingness to all quickly make the changes that are necessary when the epidemiology and the evidence in front of us warrants that. We have done this before, and it worked. We are now moving even more quickly than we did in December to resolve this outbreak. What we're working to avoid is to what we're working to avoid is situations such as Newfoundland has faced recently, that we do not want to be in that situation. If at all we can avoid that. By acting now very quickly, it puts us in the best position possible to then start to recover and in the coming weeks. So it's short-term pain for long-term success, like we did in December. But again, we're acting even faster. So our hope and our plan is that it has even a greater impact and allows us to lift things even earlier than we did previously. The Premier gave you the key restrictions, and I'd like to expand on them further. So starting tomorrow at 8 a.m. for the affected areas, which again are Halifax and the extended on our western border to include Hubbard's. The northern part of HRM includes Mount Uniac, and then the Hants Corridor, Enfield, and Elmsdale, and it extends out to Porter's Lake. So for that, for all those areas, licensed establishments will stop serving at 9 p.m. and close by 10 p.m. This is an hour earlier than the current practice. The existing hours will remain in the rest of the province. Certainly, patrons must continue to wear masks unless they are directly eating or drinking. All social events, festivals, and special events will not be permitted. Sports, games, and competitions and arts and culture performances will not be allowed. However, practices for sports and rehearsals for arts and cultural performances will be allowed to continue up to a limit of 25 participants. And as previously, for those types of activities, physical distancing is not required. Wedding ceremonies and funeral services are allowed with attendance restricted to 10, and that 10 does not include the officiants. However, receptions for funerals or ceremonies or visitations will not be permitted. Non-essential travel in and out of the affected areas should be avoided. This means that right now, starting tomorrow, people from the Annapolis Valley or the South Shore, for example, should not be looking to come shopping in HRM. Individuals living in HRM should not be looking just to go visit family and friends in Truro or up in the Annapolis Valley. Essential travel is okay if you have to travel in and out for work. For medical purposes, you've got legal or child custody issues, that's fine. But non-essential travel in and out of the affected areas should not be happening. And because we must protect our most vulnerable, there will be no more visiting at long-term care facilities in the affected area, except for designated caregivers and volunteers. And there are no trips by residents out into the community, again, in these affected areas. Some of our public health measures that are in place right now across the province won't change, so I just want to highlight those as well. The household gathering limit and general gathering limit remains at a total of 10. The restrictions on retail operations, fitness and recreational facilities, and personal care services such as hairstyling will not change. All the other measures that remain in place, there's much more detail that I don't have time to go into now. That is on our coronavirus website. But in general, for clarity, that the current restrictions that we've had across all of the province, outside of the affected areas of HRM, they remain in place. The enhanced restrictions we put in place for the affected areas in the Halifax region will be in place for 4 weeks. We'll continue to monitor our epidemiology. We certainly expect, with the increased testing we've done, and again, I want to thank Nova Scotians who are coming out. I'm hearing lots of stories about people in the appropriate communities coming out in the last day or two, even this morning, lining up in the cold to get tested. So thank you for that. We expect to get certainly much more out of all this testing. We certainly anticipate we may well get more positives, but we will continue to watch our epidemiology, and if it continues to climb over the next week, we certainly will be looking at whether further restrictions or expanding to other geographic parts of Nova Scotia will be necessary. As I mentioned, testing. I want to remind people again that we need all Nova Scotians, but especially in these affected areas, to get tested. It's fast, easy, and convenient. We've expanded in a number of places in the community center in Middle Sackville. I know there's work underway to stand up a temporary assessment center on the peninsula. More details on that to come. We have existing primary assessment centers across the province that both either asymptomatic or people who have even any mild symptoms can go to get those. And we have the mobile units from Public Health. We have pop-up sites as well in partnership with Praxis. So to look for more information of location and testing sites, you can go to nshealth.ca/coronavirus testing, and that'll give you all the information about exact locations and times for testing. And we encourage everybody to make testing part of your COVID-19 precautions, like we're asking you to continue to do masking and physical distancing. I want to talk now specifically, we've talked a lot about Halifax. The last briefing we talked a little bit, we had some concerning cases up in the western part of the Annapolis Valley. We have implemented a comprehensive testing program in that area. The uptake has been very positive. Certainly the online booking was full, and we've had strong turnouts yesterday at the mobile units. Unfortunately, so far, we're not seeing additional concerning cases in that part of the province, but we are watching that carefully. We are also, as part of this is not in response to the immediate events, but certainly we've been working on this for the last few weeks in response to the need to make sure we have strong measures at our border because of the variants. We're placing additional testing on groups who regularly travel into Nova Scotia. Effective Monday, 3 COVID tests throughout the 14-day modified quarantine will be required for rotational workers. We have specialized workers who come in. They will have up to 3 tests depending on the length of time they're here working. And parents and children whose child custody visits involve travel outside of Nova Scotia or Prince Edward Island will now have to undergo testing as well. There's a new child custody protocol with lots more details around requirements for the various types of child custody visitation situations, and today it's going to be put up on our coronavirus website. And anybody who's involved in child custody situations that involve movement of child or parents outside of Nova Scotia and PEI, we ask you to go onto the website and look at the details there. We're also making some changes to our definition of rotational and specialized workers, and that our provincial jurisdiction is only for people who travel domestically. So we're changing our protocol so it covers only domestic rotational workers and specialized workers. International rotational workers are subject to the Federal Quarantine Act, and they will have to follow the federal requirements. And again, there are more details on our protocols for both rotational workers and specialized workers on our website. And we are planning more testing requirements for other types of travelers. There are certain travelers who are exempted from the 14-day quarantine, and we're working out the final details on implementing testing for those groups as well. For the general public, I mentioned earlier this week about that we're seeing people going to work with cold and flu-like symptoms. But the reality is that we have no flu. We have this. I've been working here for 20 years, and the first year we have had 0 lab-confirmed cases of influenza. We have very low numbers of other cold viruses around. So if somebody has even very mild cold-like symptoms, there's a strong possibility that you may have COVID-19. So even if you have a single mild symptom, like a sore throat, or maybe you have a sore throat and a bit of a stuffy nose, that could be COVID. So symptoms that you may think, that we were hearing lots of stories, people saying, oh, I just got a bit of a cold, I can still go to work or go out and be active. You can't. Even with very mild symptoms, even a single symptom, you need to stay home, book a test, and make sure you don't have COVID-19 before you go back to work and resume any other activities. It's also important that workplaces need to continue to include COVID-19 protocols, including symptom screening, wearing masks in common areas, and practicing good physical distancing in meetings and other work environments. It's important that workplaces continue to do that. Labor and Advanced Education is going to be sharing new and more detailed guidance for workplaces directly with employees in the coming days. A healthy workforce is important. It's good for business, good for our community, and important part of fighting the pandemic. Before I close, I want to share some positive news. Today, Health Canada announced approval of the COVID-19 vaccine from AstraZeneca. We are awaiting guidance from the National Advisory Committee on Immunization as to how exactly this vaccine should be used in Canada. And those conversations are actively happening now that we have that Health Canada approval. But let me end today by leaving you with a path forward out of the current situation we're in and the need to impose tightened restrictions in the Halifax area. If you're socializing in large or a variety of different groups or settings, or socializing without masking, you need to stop. If you're going to work or going out and about with even one mild symptom, you need to stop. If you haven't made testing part of your COVID-19 precautions, you need to start. And if we want to see these restrictions end in 4 weeks, we all need to continue to follow the letter and the spirit of the public health measures. We've been at this for a year. I know people are tired. I know it's hard. But we have to stick with it for, as we talked about on Wednesday, the next 2 to 3 weeks, and then we're in a very different position. So we're getting close to the end, but we cannot give up now. We have to get this current surge of cases under control and do that quickly. And just because you can do something doesn't mean you should be doing it. It's important that people understand we have things that you have to do under their public health restrictions, but that's the starting point. People also need to think and use their common sense about how they go further and make sure they're doing everything they can do to minimize the risk of transmitting the virus from one to the other. We are still in the middle of a pandemic. So right now, we need to be getting back to thinking about, for the next 2 to 3 months, that we can go to school, go to work, get our essential shopping, meet with our families and close friends in very careful ways, but that's it. If we keep following that, we will get through the next 2 to 3 months.
We'll now go to questions. We'll do one question and one follow-up in the amount of time that we have for today. We'll start with questions in the room, and then we'll go to the phone. First question will go to CTV's Natasha Pace.
Dr. Strang, why did the province set up a pop-up testing site at Irving, but not, for example, somewhere where Halifax transit workers could access it? A lot of them are having difficulty getting time off work to get a test done.
So we're working with Irving to make sure that we've had all their close contacts identified. That was our first priority. There's almost 2,000 workers at that work site, and that the large volume of workers really meant that we needed it. We want a priority to get everybody else tested, and but to do that volume of people, the most logical thing is to bring testing into that large work site. It's by far the biggest work site of anywhere in the province. The other piece is that we have workers come from well outside of HRM in many ways, so we need to be rapidly test everybody. The most logical thing to do was to stand up a testing site right at that work site.
Go ahead with your follow-up, Natasha.
Okay, and is there just still one confirmed case at Irving Shipbuilding at this point in time, or are there?
One confirmed case, and I want to clarify, it's at the Halifax shipyard. They have a number of other work site locations that have not been affected. There is no movement of workers between the different locations. So the current, the temporary stoppage at that is only at that location because and we're working around that specific location.
Next question will go to Jack Julian with CBC.
My question is for Dr. Strang. My first one, the province right now is being lobbied to allow on-site vaccinations at long-term care facilities. And I'm just wondering, what are your plans for on-site vaccination clinics at nursing homes? And what would be the rules and on what timeline?
So this is about the different types of vaccine products we have. So we have the Moderna vaccine is only a regular freezer product. It's much easier to transport and move around, but we have a limited amount of that. We always have. So what we've done, we've moved the Moderna vaccine to long-term care facilities and using that to vaccinate residents, designated caregivers, and people who have difficulty getting vaccinated elsewhere. For the staff, we're using the Pfizer vaccine, and so we're getting staff at the long-term care facilities to go to one of the many healthcare worker clinics that we have around the province. It's simply because we need the limited amount of Moderna we need to use for vaccinating in the facilities. And so that needs to be primarily for residents. Staff can go elsewhere. They're able to move out of the facility and go get vaccinated. So they can do that. And we've made, they have easy access. We have many healthcare worker clinics around the province.
Go ahead with your follow-up, Jack.
In terms of a follow-up, what percentage of residents have been vaccinated in long-term care facilities?
I don't have an exact number. We're having a technical briefing on Tuesday with a much more detail, and we'll have much more detailed numbers, including things like that, next week.
Next question will go to All Nova Scotia's Lindsay Armstrong.
Thank you. A question for the Premier. Given what Dr. Strang has just said about the importance of staying home from work right now, if you have a stuffy nose or cold-like symptoms, I'm wondering what you would say to the numerous workers in Nova Scotia who do not have paid sick time and who may financially not be able to take time off work.
It's a good point. I think that it's important to have those discussions, and it was a point raised when I reached out to one of the opposition leaders, and I met with him to discuss options so that we can support our workforce. A lot of employers do provide that benefit, but it is something that we'll continue to discuss moving forward.
Go ahead with your follow-up, Lindsay.
Thank you for that. And Dr. Strang, I understand the AstraZeneca announcement is very new. I'm wondering if you can give an approximation of how dramatically this may impact the Nova Scotia vaccine timeline.
So we don't have certainty yet about, as I said, it was just this morning, and I've been involved with lots of other issues today. Last night, I haven't had a chance to look at I have a meeting later this afternoon with one of my kind of vaccine specialists on my team to understand a bit more very early. And we're not sure about. We're going to get limited amounts. The amount of it's only a small percentage of our vaccine supply is ever going to come from AstraZeneca. So I think we got to figure out a lot of those details. It's just kind of breaking news today that it's been approved.
Next question will go to Tim Biscay with the Halifax Examiner.
Dr. Strang, back in early January, your health department made clear that the projections on vaccines coming to Nova Scotia was very tentative. but then it was projected, hoped for, I guess, that 140,000 doses would be delivered by the end of March. Just doing back of the envelope calculations, it looks like there was a decrease through February because of Moderna was diverted and Pfizer retooling, but there's been an increase since then, especially this week. And if that moves forward and we get the 28,000 Moderna that were expected in the middle of March, we'll reach that 140. Is that accurate?
So I haven't gone through all the numbers myself, but my vaccine team has said we're on track to to get the expected amount of vaccine for the first 90 days, which is January, February, March. We know we're getting 10,000 doses a week of the Pfizer vaccine until the end of March. Beyond that, we don't have certainty, but everything we're hearing is that we're still in the position where we're going to, in April, we'll start to see a dramatic increase in the amount of vaccine coming to the province.
Go ahead with your follow-up, Tim.
You've made clear that the intent for vaccination is by age cohort, and you explained why, but there's a lot of concern that the virus is being brought in from outside the province by rotational workers, essential workers, that sort of thing. Would it make any sense to move them up on the vaccination schedule just because that is the source of the virus coming into the province?
We talked in the last briefing, a couple of briefings ago, I talked about this, and we'll be going into this in more detail on Tuesday at the briefing. Along with our age-based as we get more vaccine, our primary approach is going to be based on age, but there are some populations that we're also going to focus on. We're going to continue to focus on people in aggregate living situations, long-term care, adults with other types of disabilities in group situations, moving into things like correctional facilities, shelters. Along with that, I've talked before here about our vulnerable communities, our First Nations communities, African Nova Scotian communities, but we are also going to be, for the points you actually raised, the people who are at some of the highest risk of bringing the virus into the province, rotational workers and truckers. We're working to find out how we get them vaccinated as a priority once we get adequate vaccine supplies.
We'll now go to the phones. First, we'll go to Elizabeth McSheffrey with Global.
Thank you. Dr. Strang, I know you've mentioned you're still waiting for guidance on the AstraZeneca vaccine, but I'm just wondering if you can share your thoughts about whether you want to have that vaccine in Nova Scotia and how you're going to ask somebody to take a vaccine that's roughly 60% effective when they might very well prefer to have a vaccine that's more than 90% effective. How do you ask somebody to do that?
So we've had lots of discussions on this in the last few weeks at the Chief Medical Officer of Health table nationally. So those are the conversations I'm going to start later this afternoon with my vaccine team around this. Those are good questions, but there is a place for how we use these vaccines. We've got to make sure we use it, but what is the best place on how we use that? Lots of work to do to figure this out.
Go ahead with your follow-up, Elizabeth.
And my second question pertains to the 1 hour reduction in the restaurant times. I'm wondering if you can share a little bit about the evidence for suggesting that the 1 hour time reduction is effective. I don't know if that's anecdotal or based on cases, but what difference does that 1 hour precisely make?
So the 1 hour itself, it just, what it does mean, what we're really trying to focus on is that we know that in settings, any type of setting where people are in close proximity for longer periods of times, especially when they don't need to wear a mask, which includes places where people are eating and drinking, that is certainly settings that are at significant risk for transmitting the virus. What we're doing with the restaurants, we always try to find a balance. How do we allow an activity to happen as much as we can and allow a business to operate as much as we can, knowing that to shut something down completely has its own set of significant impacts. So we're trying to find a balance to allow our restaurants to continue to operate. But in some ways, what this does, it sends a very strong signal to the public that we need to actually be smarter. We've had too many people are going out to multiple restaurants many times a week. That the restaurants themselves are not problematic. They're doing a very good job, but how the public are using the restaurants, the frequency, the going to restaurants different times with different groups of people, the choices people are making when they go out to dine is problematic. So part of what we're doing is working to keep the restaurants open as much as possible, but also sending a very strong message, because the business model of restaurants is built on socializing. So it's finding that balance of sending a message to the public that excessive socializing cannot happen, but also trying to minimize the impact on the restaurant sector.
Next question will go to Danielle Edwards with the Canadian Press.
Hi. I think this question is probably best given to Dr. Strang, but I'm curious about whether or not there's a concern the increase in cases is connected to the variant of the virus that originated in the UK.
That's certainly one of our concerns. We've sent off a number of tests of this week for variant testing because they still have to go to the national lab. We won't get a result back. There are some delays in that, even if we request urgent testing. Certainly, one of the initial cases up in the Annapolis Valley was a variant strain, and that's one of the reasons we moved in there very quickly with testing. But fortunately, we're not seeing signs of further spread, at least in these early stages. But one of the reasons we're acting even faster now than we did in December is because of this concern around a variant. And if you let a variant start to spread, as Newfoundland is an example, it's very hard to control.
Go ahead with your follow-up, Danielle.
In the case that there is evidence that the variant is cause of the recent spread, what sort of restrictions will Nova Scotians see put in place?
So the measures you use to control the spread of the virus don't change just because you have a variant. What the variant means is that the risk of large spread is increased, and therefore you need to be very cautious and quick when you're using the public health measures. It also means that a reminder to Nova Scotians and why all of us, the things that prevent the spread of the virus, keeping ourselves apart from people, especially if we're unmasked. I've heard a lot of talk in the last couple of days, people, infectious disease experts saying, avoid people breathing on you, which is that's how the virus is spread. So all those steps we need to be even more careful of in the choices we all make and the measures we all take when we now have the issue of the variant. But again, it's also why we're acting even faster and more and quickly with strong measures very early on because of the risk that this could be a variant and the potential for it to get out of control quickly.
Next question will go to Nabal Snam with the Herald.
Good afternoon. Dr. Strang, I was wondering if you can confirm if the clusters that we're talking about in the greater Halifax area are the ones in Beaverbank and the Sackville areas, or have they expanded further, or are we talking about something new?
So as I said in my remarks, we now have individual cases where we don't know a source where they got infected from in many parts of HRM. Though those individual cases are not, we haven't seen connections between them at this point, which is even more concerning because we're having now these unexplained cases popping up in multiple communities, parts of HRM, and there's no common thread between them. The strong likelihood of that means that there's a low-level circulation of the virus that's been happening for the last couple of weeks, and we're just starting to see it now. Therefore, we need to act and lock things down to a great extent now to prevent any further and greater spread.
Go ahead with your follow-up, Nabal.
Thank you. I was wondering if you can tell us a little bit about what we know about how effective the Pfizer, Moderna, and AstraZeneca vaccines against the UK variant.
So there's nothing to suggest that I'm aware of that the vaccines don't have the same or close to the same effectiveness against the UK variant versus other variant strains.
Next question will go to Adrian Blanc with Radio Canada. Adrian, are you on the line? Sullivan with Cape Breton Post.
Hello, yes, hi, thank you. This is for Dr. Strang, and it's a continuation on what you were explaining about the vaccine rollout and about how predominantly now you're going off of age, but eventually we'll be spreading it out. I'm wondering where disabled people with underlying conditions fit on there. You know, there are some people who are with spinal cord injuries or neck injuries who don't have respiratory muscle use, who are in their 20s, but right now are still waiting for a vaccine when they are at high risk of severe complications if they contract COVID. So I'm wondering, like, why aren't people like in this category, disabled people with underlying conditions like this, being looked at as a case-by-case basis for early vaccination?
So we're certainly looking at people with whether it's physical, mental health, intellectual disabilities, adults living in congregate living situations, and even many of them are in common workplace settings like workshops that we're going to make them a priority as we move the group of people that we call live and work in congregate settings. Starting with long-term care facilities, we've already started to immunize in some of our larger facilities that have adults with disabilities. We'll continue to work with the disability community around. We have people in small living situations, small option homes, how we could actually accommodate them, and many of them go to a common workplace. Working to figure out how we get those immunized. The one-offs, we have to understand that first and foremost, by far the greatest risk factor for severe disease is age, by far. So and that if we go down the road of developing one-offs or different categories, whether it's health condition or we have many occupational groups who are lining up and saying we're essential, we need to be vaccinated first. If you go down that road, you actually slow down substantively the rollout of your vaccine program. If we stick with mainly an age-based vaccine program, that allows us to get to our endpoint the fastest, and that endpoint is giving every Nova Scotian the chance to get vaccinated. We want to get there as quickly as possible, and also as we the faster we can roll out a vaccine program, we're building herd immunity, and even those who are still waiting are protected because we're building herd immunity. So my job is to look at how we roll this out that is has the greatest protection for all of Nova Scotians. And I get the one-off situations, but by sticking primarily with an age-based process, we will provide protection for all Nova Scotians directly and indirectly in the fastest manner possible.
Go ahead with your follow-up, Nicole.
And this is in relation to the case in the Eastern Zone. We've received information from multiple sources that the cases in Cape Breton and Glace Bay, and that with contact with students in the area, social media is going off. People are, obviously expressing fears and stuff. What would you suggest to a community that's talking about this? Would you say the community should be going towards asymptomatic testing?
Well, certainly a couple of things there. So, first of all, people have to understand what the requirements for isolation for different groups. We've had this before. Rotational workers are actually allowed to be out and about in their communities with their family. So we've had this before where people are reporting that so-and-so shouldn't be out and about, where actually they're doing what they're allowed to do as a rotational worker. So first of all, don't be careful about making judgments about what people are actually out doing if you don't understand what they're actually are allowed to be doing. Second of all, if there's legitimate evidence that somebody is not following their quarantine or their modified quarantine, then the route to deal with that is to go out and connect the non-emergency line with your local police department. We have ongoing discussions with police about their role in enforcement of these types of situations. The third part about testing, we're encouraging all Nova Scotians, whether they're concerned about the activities of somebody else in their community or not. We're encouraging all Nova Scotians to incorporate, testing, whether it's asymptomatic testing or as I just talked about, with one mild symptom. Build testing into your part of your COVID protocols, not just because you think somebody in your community may be doing something that they shouldn't be doing.
Next question will go to Victoria Walton with the Coast.
Thanks. Good afternoon. There was a release earlier that there's been some pop-up testing canceled at the Elmsdale Fire Hall, and St. Andrew's United Church. Says to support other testing, and I'm just wondering, with the encouragement for getting more testing, why some have been canceled.
So there's no doubt that we are stretched right now with our testing resources. I do want to give credit, though. In the last 24 hours, the Nova Scotia Health has done amazing work in terms of bringing people and in both for the laboratory and the primary assessment centers and other ways to get people tested, the mobile unit, etc. So we may have to be shifting things around a little bit, but overall there's been a tremendous increase in access to testing in the last 24 to 48 hours, and I thank the Nova Scotia Health Authority for their work on that.
Go ahead with your follow-up, Victoria.
Thanks. And the other thing I just am wondering, I guess, the short notice of these regulations coming into effect at 8 a.m. tomorrow, for people who have planned events or things, whether it was a sporting event or a cultural event, what was the thought that went into, how urgently this had to be done versus, because regulations were so open for the past little bit, people had started to plan stuff?
Well, I mean, we certainly recognize that the imposition that it puts on people and businesses and organizations, but hopefully people have understood that as we go through this pandemic, that we don't have the luxury of announcing something and waiting for it to come into effect for a week. That we have to act, and we have to act fast. And I apologize, and I'm sorry for the burden that places on people, but I'd much rather apologize for that than to sit here and have to apologize why the virus is now out of control because we didn't act quickly.
Next question will go to Jean Laroche with CBC.
Good afternoon, Dr. Strang. I just want a clarification in terms of the Irving situation. If memory serves, and correct me if I'm wrong, when we had the outbreak at the Eden Valley plant in the Valley, the government ordered the plant closed. You're not doing so with Irving. I'm curious to know why there's a different approach in terms of the shipyard.
Irving, we had lots of discussions with Irving last night, and they were cooperative. They made the decision on a temporary closure or temporary shutdown. It's only a single case. We have to remember that. We had an outbreak at the Eden Valley poultry plant, and there were different circumstances that required us to shut the whole place down. Right now, we have a single case. Irving has been very cooperative. They're having a temporary shutdown while we investigate that single case and do testing around that. Whether we have to go further than that, well, what happens with the ongoing investigation and the testing in the few days ahead will tell us that. But again, it's different circumstances and different workplaces.
Go ahead with your follow-up, Jean.
Thanks. Dr. Strang, this is going to seem really self-serving because I ski, and so do hundreds of others who live in the Halifax area. And there's no way anyone's going to suggest that going to a ski hill or leaving the city to go snowshoeing or on hikes or winter sports is essential travel. But it certainly is keeping a lot of people healthier physically and psychologically. So do you still recommend that people who are leaving the city to go do an outdoor activity restrict their travel for the next month?
I think we have to, HRM is a broad category, and I get it, Jean. I know you're a skier, and we only have a couple of ski hills in mainland Nova Scotia. But staying within HRM, there's lots of scope for outdoor activity. So again, living within this, not just the intent, but the spirit of the restrictions, we'd have to ask all skiers to adhere to that.
We have a few moments left. We'll go back to the room to CTV's Natasha Pace. Do you have another question, Natasha?
Just Dr. Strang or Premier Rankin, police are still handing out tickets for people who aren't adhering to public health guidelines and aren't following the gathering limits. What would your message be as we head into another weekend?
So I thank the police for that work. I mean, it's unfortunate, but we do need to have an enforcement component to that. But hopefully, people are listening to the message that that we all need to, to up our game, if you will. We all need to very carefully follow all the COVID protocols. As I understand the burden of some of the restrictions, but it's short-term pain. We can get through this in the next few weeks if we all buckle down again and take control of this. Where we end up and where we might have to go in the next week or two, quite frankly, depends on how willing all Nova Scotians, especially people living in the HRM area, are to do their part and help us bring this under control.
Natasha, do you have a follow-up?
No, that's fine. Thank you.
Moving on to Jack Julian with CBC.
This is for Dr. Strang again. I was just wondering, can you typify who it is that's socializing with multiple groups, not wearing masks, and who it is that's going to work with just a single symptom? So I'll start the single symptom. We've only had a few cases, but unfortunately, several of our cases in the last 48 hours have been people, and it's human nature. I mean, we for decades we've been saying, well, I can still go to work, I got a bit of a cold, etc. But this is COVID. We need to behave differently. Even if you have a mild symptoms, a bit of a stuffy nose and a sore throat, that could well be COVID, as I explained, because we don't have a lot of other viruses, respiratory viruses around. So we need to think about each other and stay home, get a test, even if you're very mildly symptomatic. For all the other pieces, I mean, it's broad. As we investigate cases and their contacts, clearly people have become far too relaxed. And we're acting in the last few weeks that, and maybe it's because people felt Nova Scotia's done such a good job. We've now opened things up. We don't have any COVID. And we're tired, so we're just going to go back to living life basically as we did prior to COVID, and not have any restrictions on our activities, other than living within smaller groups as we go out and doing things. We need to rein that back in, and then for the next few weeks, it's got to be go to work, go to school. What's essential in my life I need to do, and limit the non-essentials.
That's all the time we have for questions today. Thanks very much, Premier.
Thank you. In closing, I just want to say that we can't back off now, especially with the vaccine so close. In fact, as we mentioned, the federal government has just approved the AstraZeneca vaccine. That's the third vaccine, so that's good news. But let's look at our immediate situation. We're heading into a weekend, and I wish I could tell you to go out and enjoy yourself, but I can't do that. I'm asking you to stick close to home and keep your circle small. None of us wants to return to double-digit cases numbers and more restrictions. None of us wants to put our families and friends at risk. Nothing is worth that. We all know that can happen because we've been here before, and we've seen what's happened in other provinces. But we've also shown the world what we're capable of. We're known as a place where COVID wasn't welcome. The place with people who are willing to do whatever it took to send COVID packing. We did it before, and we can do it again. And let me remind again to practice all protocols, including wearing a mask, social distancing, and washing your hands. Thank you.